Okay, so hi, my name is Gemma McDonnell. I'm a final year medical student at the University of Limerick, and I'm happy to present my research here today. So the topic of our research is hand hygiene, medical students versus the public, assessing knowledge, attitudes and behaviour. So this was performed by a small group of medical students, including myself, with assistance from Dr. Sarah Hyde and Dr. Patrick O'Donnell. So is it changing slides? Sorry, I don't see it on my screen here.
Yeah, it is. It's onto the background KAP.
Excellent, thanks. Okay, so the purpose of this study was to assess the knowledge, attitudes and behavioural practices towards hand hygiene in medical students in Ireland in comparison to the public, and there was a special emphasis placed in relation to the COVID-19 pandemic. So the primary focus of the study was to explore if there's any differences or similarities in this area amongst our two chosen populations. So the global response of the COVID-19 pandemic has included legislative, economic and policy actions. Many measures have been recommended to limit the spread of COVID-19, as we all know. So hand hygiene is a globally accepted method of reducing the incidence of respiratory infections. Thus, its importance has especially been emphasised this year with a noticeable cultural shift. So, for example, the sales of hand sanitizer have skyrocketed due to the increased interest in hand hygiene from the public. So the literature shows a significant amount of research has been done in this area amongst healthcare professionals, but a relatively small amount of similar research has been done amongst the public group. So previous studies have also showed that medical and nursing students may have a suboptimal level of knowledge about hand hygiene and similar with their attitudes. So the study employed a standardized questionnaire, and this was adapted from one developed by Rosen et al. In 2009. And this was circulated electronically via the Qualtrics platform. It was carried out between August and October 2020. So the questionnaire composed of 35 questions, and these included multiple choice yes or no answers and Likert scaling options as well. And it was divided into our three sections. So knowledge of hand hygiene, attitudes toward hand hygiene, and self-reported hand hygiene behaviours. Medical students at UL were invited to participate online, and the public were also invited through social media networks. So these included WhatsApp, Twitter, and Facebook. So in terms of composition of our participants, about 75% of them were from Ireland, 19% from Canada, and 6% were from other countries. There were 303 respondents included in our analysis, and 63% of them formed the public group and 37% of them were medical students. So data was then analysed using Microsoft Excel, and the p-values were calculated using chi-squared goodness of fit model. So moving on to our results now. So represented here is the results from the knowledge section of the survey. This table summarises the results and shows the percentage of each group which answered correctly. So statistically significant data is put in bold and marked there with a red asterisk. So we found that knowledge of hand hygiene was actually similar between both groups. Two questions were more likely to be answered correctly by the general public. So they're the first two questions there, 1.1 and 1.2, but these did not reach statistical significance. All of the other questions were more likely to be answered correctly by the medical students, but only reached statistical significance for the ones marked there, 1.3, 1.4, 1.5, 7, and 8. And the p-values here were less than 0.05. But of note, 100% of both groups answered correctly to question 1.9. So we'll move on here now to the attitudes section. So overall, there was no significant difference to the attitudes towards hand hygiene between each of the groups. 100% of respondents from both groups agreed with our statement 2.1. And this showed that they all agreed that it is important in improving our health. Questions 2.3, 2.6, 11, 12, and 13 also showed that 90% of our respondents from both groups agreeing with these statements, showing that both the public and the medical students have a very positive attitude towards hand hygiene overall. So now in terms of self-reported behaviour and practices, these results also show a very similar pattern to attitudes. There was no significant difference in self-reported behaviour towards hand hygiene between these two groups. 98% of the medical students and 99% of the public group responded that they always agree with statements 3.4 and 3.9. However, question 3.6 is also of note, showing that only 33% and 35% of the public group said that they always wash their hands after handshaking. Another question of note is 3.10, where 43% and 34% of medical students said they always wash their hands after removing their mask. So to kind of summarize this, I have it in 3 little tables here. So from the study, we found in the first box that all participants displayed good knowledge of hand hygiene. This now could possibly be due to the efforts made globally to raise the hand hygiene awareness this year. Nonetheless, there still remains a slight gap between both groups. This was signified, for example, when asking if removing watches and bracelets is required during hand washing. These results show that the global awareness and hand hygiene has increased, but work still remains to further close the gap in best practice. So now for the attitudes table. Interestingly, COVID-19 has largely impacted the 2 groups' attitudes. Both groups have actively started to practice hand hygiene more than they used to before COVID-19. Additionally, 97% of the public group and 98% of the medical student group would like to see all stores and supermarkets continue to provide complementary use of alcohol-based sanitizers in the future. The response of maintaining continued measures can impact the way society maintains its progressive stance on hand hygiene. So now of note in the behaviour section, although the reported attitudes were very positive towards hand hygiene, this didn't always translate into reported behaviours. For example, only 33% of medical students and 43% of the public stated that they always wash their hands after removing their mask. A similar pattern is also observed when asked about hand washing following handshaking. And another concerning behaviour was the lack of hand washing within both groups after coughing. So these 2 findings in our study were actually quite concerning, especially due to the common nature of virus transmission through hands and through coughing. So overall, our study shows that both medical students and public participants displayed a good knowledge of hand hygiene. No participant indicated that they disagreed with hand hygiene being based on sound scientific evidence. Of interest, the apparent influence that the pandemic had on individuals in terms of hand hygiene is observed in this study, with over 90% of people from both groups acknowledged that they now actively practice hand hygiene more regularly than they did prior to COVID-19. So in order to further explore the impact of the pandemic on knowledge, attitudes and practices of hand hygiene, we would suggest maybe evaluating a similar population at different time points in the future. It might be interesting to see if the focus on hand hygiene changes as the progression of COVID-19 changes and after all the vaccinations are rolled out, for example. Another area to explore might be a comparative analysis between different populations of healthcare workers. So this might help to show if there's any discrepancies in hand hygiene and where maybe additional training measures are needed. Similarly, the desire for wearing face masks, both within and outside of the healthcare setting, could be evaluated to understand the needs and wants of various populations going forward. So that concludes my research here today, and I would like to thank everyone for listening. And I'd also like to thank the conference organisers for giving me the opportunity to present our study here today. And I would like now to invite questions from anyone that you may have, so please go ahead.